So again, good morning, good afternoon, good evening, wherever you are in the world. My name is Peter Johnson. I'm the Senior Director for Nursing and Midwifery at JPIGO. I am honored to act as the Master of Ceremonies today for this global webinar on midwifery in the 21st century. Investment, empowerment, and resilience of midwives in the midwifery profession is the themes for today. So next slide, Shante. Okay, so again, I am Peter Johnson. I've been with JPIGO for several years. I am a nurse and a midwife and an educator myself. And I am very, very pleased to be with you during this year of the nurse and the midwife to talk about some exciting events and opportunities. Next slide, please. Okay, we have a very packed agenda today that will start with introductions and a keynote address. We'll move from that to have a very exciting direct line presentation from midwives that have been actively engaged in supporting their midwifery professions in both Afghanistan and Tanzania. They will talk about both best practices, or good practices, I should say, and challenges that they've encountered. And then we'll move into a robust panel discussion with global experts that will, from a variety of perspectives. That panel will be moderated by Ms. Teresa Schaefer from the U.S. Agency for International Development. And next slide, please. Housekeeping, just a few things here. One, just full disclosure that the webinar is being recorded this morning, and the recording will be made available at the website listed here, but we'll make sure that we're transparent and you know where to find this, and we would appreciate all efforts to pass this along to people that can't attend this morning. We'll also have two question and answer sessions throughout, one during our presentations from our country presenters. If there are questions, clarifications that you feel important, please put them into the question and answer box. We will be screening and we will take those questions at that time. And then at the end of the panel, same thing. If there are questions for the panelists or clarifications for the panelists, if you have comments, please put them into the question and answer, not the chat box, but the question and answer. And our moderator will take up those questions, as many as possible. Now, the chat will also be open throughout, so feel free to use that to have conversations with one another, put your reflections in. We love to have the interactivity during this kind of a webinar, so welcome. You have 250 of your colleagues here right now to speak with. That number is growing as we speak. Next slide, Shante. Well, it's my great pleasure to introduce our first speaker, Dr. Leslie Mancuso, who's going to do our introduction. Leslie is the president and CEO of JPIGO. She has an earned PhD and is a member of a fellow in the American Academy of Nurses. I've known Leslie for several years. Her honors and her contributions are way too many to go into here. So in order to move on, all protocols observed. And Leslie, over to you.
Well, thank you so much, Peter. Good morning, good afternoon, good evening, wherever you might be, welcome. As Peter said, I'm Dr. Leslie Mancuso, the president and CEO of JPIGO, and it's my honor to open this timely discussion on midwifery in the 21st century. Today, we have a group of remarkable speakers and panelists who are going to bring you to the front lines of midwifery in Tanzania and Afghanistan. As well, they're going to lead a discussion on how best to improve investment, empowerment, and resilience in this essential cadre. The time for discussion is now. Over the last 9 months, we've had the worst health crisis in a century. And as such, we have a dual challenge. First, to continue to mitigate the effects of COVID-19. And second, to continue to ensure that all families have access to life-saving care no matter where they live. This is a tall order. In the countries where JPIGO works, issues related to fragile health systems have been further exposed and exacerbated by this virus. What COVID-19 has taught us is this virus is not an equalizer, but it's a magnifier of inequalities. But there is good news. Around the globe, midwives are key to leveling the playing field. Before, during, and after emergencies, it's midwives that are ensuring that women and children have access to quality, life-saving care, including in countries that have such challenges with healthcare. In this year of the nurse and the midwife, their essential contributions every day in every country are being recognized. It's also being recognized that we must build this health cadre in number, in quality, and in legal authority if we're going to meet our global goals. There is no doubt that none of our aims to eradicate poverty, to empower women and girls, to reduce stubborn inequalities that exist within countries and across countries cannot be met if we don't address the global shortage of 18 million health workers, predominantly in low and middle income countries. Building stronger health systems and resilient communities for the future takes a number of things. First, investment. Investment in strengthening midwifery and nursing global workforce, and making sure that their hard-earned gains they've made in maternal newborn health are left intact, while at the same time accelerating quality, women-centered, respectful care for mothers and newborns. As well, we must invest. We must make sure that we look at empowerment, making sure that midwives have the necessary skills to be successful and to be respected among their peers across health systems and across health professions. And as well, we must look at resilience. Midwives must be able to be supported and protected, even though they face a myriad of security and safety challenges. They work in a fragile work environment, and they are a female-dominated profession, which leads to a great deal of this. Now, for decades, from countries as far as Egypt to Guatemala, JPIGO has continued to demonstrate that investments in midwifery lift up the health of communities. Because where healthy women live, there are healthy families. And where there are healthy families, there are healthy communities. Today, we're going to talk about two midwifery programs from distinct parts of the world, Tanzania and Afghanistan. In Tanzania, the More and Better Midwives program has used gender transformative education to improve recruitment, to reduce inequities, and to strengthen professional governance. In Afghanistan, the Himayat Project has reduced professional rivalry, has improved collaboration, and very importantly, has promoted entrepreneurship of midwives so that they can enhance client-centered care on the day of birth. Now, these successes also had their challenges, but what we have seen is robust midwifery programs can and are accelerating progress in maternal newborn health. And with that, I welcome our next speaker. I thank you all once again, the hundreds of people online, for being with us today. Thank you so much.
Thank you, Leslie, for what was a very, in my mind, a very positive call to action, outlining the many, many things that that midwives need in order to be able to maximize their resilience. Work still to be done here. My great pleasure next to introduce Dr. Annika Knudsen. Annika is the chief of the Sexual and Reproductive Health and Rights branch at the UNFPA, United Nations Population Fund. Annika is both a midwife herself as well as a staunch advocate of midwives and the midwifery profession. And all that goes into that. We have been close collaborators at JPIGO with Annika for many years, and I'm pleased to call her both a colleague and a friend. So Annika, over to you.
Thank you so much, Peter. And thank you, Leslie, also for that very passionate introduction to this event. So good morning, good afternoon, and good evening to all of you, wherever you are on the globe. And I could see from the chat that we have a big audience. That is really what this new virtual world brings us to, closer together, even though we don't get to travel. Let me first say that it brings me real pleasure and excitement to provide what I would call the introductory note in this very important event on midwifery in the 21st century, followed by great presentations and a great expert panel discussion to follow. In this, the decade of action, as the Secretary General has announced, and in the year, and I would say decade, as ICM states it, of the nurse and the midwife. A midwife myself, with many years in development, I truly believe that midwifery is the backbone of a health system that aims to deliver for individuals, for women, for young people in their sexual and reproductive health needs. Midwifery, of course, also plays a central role for universal health coverage. And in every society that aims for gender equality and women's empowerment, midwifery is essential. Midwifery is also a large part of the solution, of course, to end preventable maternal mortality, one of UNFPA's 3 transformative results, and why we as an organization have a huge program on midwifery. But before I continue to talk about the theme today, I would like to pay tribute to all the midwives and all the nurses that have worked tirelessly at the very front line of the pandemic, and in particular, those that lost their lives in their aim to save and support others. I would like to think that this event and bringing midwifery as an important topic to the UN General Assembly discussions this year is in your name. There could not be 3 more important concepts for midwifery in the 21st century than those before us today. And why do I say that? Investment, empowerment, and resilience are 3 really central prerequisites for a rights-based and sustainable development agenda at large, and for a health system to be able to respond and be prepared to deliver for women, girls, individuals in a way that ensures that they, their newborns, their families and communities survive, thrive, but also can transform. That is what we have promised as a global community in the SDGs. So to address these 3 concepts, let me just start by saying a few things about what midwifery is and the midwifery model of care entails. Midwifery is, as you well know, the health science and health profession that deals with pregnancy, childbirth, and the postpartum period, in addition to the sexual and reproductive health of women throughout their lives. And I think that's very important because in many countries, it's just seen as a pregnancy and childbirth related profession. The midwifery model of care is a model of continuity of care with the individual in the center that provides skilled, knowledgeable, and compassionate care for childbearing women, newborn infants, and families across the continuum of pre-pregnancy, pregnancy, birth, postpartum, and the early weeks of life and beyond throughout the life course. It ensures quality care with a focus on the normal life event, with competence and preparedness for the complicated. So it's really, I want to say that again, because it's really with a focus on the normal life event of all the events in a person's life on sexual and reproductive health events, and preparedness for the complicated. Every woman has the right to experience their pregnancy and childbirth event as a positive and happy experience. So this builds up to why we should invest. Studies like the midwifery series in the Lancet showed us that there is a historic sequence of health system changes that made a reduction in maternal mortality possible in countries that have expanded their midwifery workforce. Achievements of better health outcomes for women and newborn infants is possible, but needs improvements in the quality of reproductive, maternal, and newborn care, alongside necessary increases in universal coverage. This is why we need to invest in midwifery. We know that when well-educated, equipped, and supported, and I will come back to that, what I mean by that, the midwife can provide 87% of sexual and reproductive health services that young people, women and men and newborns require. This is why we need to invest in midwifery. I will also now reveal some very, very new data and estimates to you that will soon be published in the British Medical Journal. It's really a steaming fresh study by WHO, UNFPA and ICM leading up to the next State of the World's Midwifery Report 2021, where we again see that midwives who are educated and regulated to global standards play a vital role in reducing maternal and newborn deaths and stillbirths. So the estimate is that the universal coverage of midwifery delivered intervention could actually avert approximately 65% of all maternal and newborn deaths and stillbirth. This amounts to 4.3 million deaths averted per year up to in 2035, and 2.1 million newborn deaths and 2 million stillbirths. Those are huge numbers. If we look at the less ambitious scaling up of midwife-delivered intervention, let's say 25% increase in coverage every 5 years, that could still avert 2.2 million deaths per year by 2035. Even a modest increase in coverage, 10% every 5 years, could avert 23% of what we now have of maternal and newborn deaths and 14% of the stillbirths. It could also, if we increase the coverage of midwife-delivered interventions, help reduce the number of abortions from 40 million to 25 million, help avert 44% of infant deaths due to HIV from 27,000 to 15,000. This is why we need to invest in midwifery. So what does that mean then, to invest? As Leslie was saying, we need to invest in education to global standards, but that should also include leadership skills, decision-making skills, and critical thinking. We need to invest in supportive supervision, in continuous on-the-job training and mentoring. We need to invest in faculty development, but also on the legislative side, on regulation and accreditation. And then we also need to make investments in the enabling environment. And this includes the ability to practice to one's full scope of practice, the ability to make and be accountable for independent decisions within the regulated scope of practice. It means a functional health infrastructure with adequate human resources so that midwives do not need to work around the clock themselves without any support. There needs to be other kinds of support, equipment and supplies, and access to timely and respectful consultation, cross-professional collaboration and referral, and safety from, of course, physical and emotional harm. And last but not least, equitable compensation. These are all also core to the empowerment of midwives and midwifery. And even though midwives in many places today are well recognized, there are still many more places where midwives are still at the lowest end of the health system ladder. To me, in the end, the investment comes down to the individual, the life, the health, and the experience of every woman, girl, and newborn. It is really a matter of human rights, and it is a matter of empowerment. And that is the human right also of the midwife and the empowerment of the midwife. So empowerment and midwifery is twofold. The empowerment of women that midwives and other midwifery providers enable and support through their partnership with the women they care for. They are the model they are in so many countries to so many women, to so many of us that have experienced the support and encouragement of a midwife accompanying us in the birthing process and other parts of our SRH service needs, is someone very special, a professional. This can, however, not happen if we don't invest also in the empowerment of the midwife and the midwifery provider themselves. All of what I've already mentioned as important areas for investments will also enable the empowerment of midwifery. The continuity of care, midwifery-led care, requires that we recognize the autonomy of the midwife for taking charge of the normal, that we recognize midwifery for the profession it is, that we trust their leadership, their competence and capacity, and that we recognize that although not all midwives in the world are women, many are, and so are exposed, as Leslie mentioned, to the same gender norms as their clients, the same structural discrimination that adds to determinants of maternal mortality by denying women's right to decision-making, education, and deployment. This impacts the midwives and that care for them in similar ways. Denying them a seat at the table when plans and decisions are made about their work and work environment is detrimental. In the COVID pandemic, we have seen that midwives and nurses were the last to receive PPEs, but were still expected to stay at the front line. 70% of the global health workforce is female. Only 25% of health leadership positions are held by women. Those figures speak for themselves. To round up, let me just say this about resilience. Women are resilient. Midwives and other providers of midwifery care are resilient and have shown great resilience, not only in the current pandemic, but in all the humanitarian crises that are ongoing, man-made or caused by natural disasters. But we can't depend on the resilience of the individual. We need to build resilient health systems with a resilient midwifery workforce, investing in and empowering midwifery from the rights-based and person-centered approach. I have talked here about what I have talked about here will contribute to a resilient health system and a workforce that really can not only withstand and cope with the massive changes that happen, but really can recover and develop further. Midwifery is the real game changer. And so we believe in UNFPA and in all the partnerships around the world we have with ICM, WHO, JPIGO, and we really want to bring that to a huge global partnership because midwifery is the real game changer. Thank you.
Annika, thanks for what I knew would be a very robust and complex analysis of a complex set of issues. I, as a midwife, I look forward to these game-changing events and being part of helping things to happen. I really appreciate you bringing out some of the important and complex gender elements that impact our profession. I do want to say that I am very, very pleased to watch the participant list here grow and grow, and to say that I'm not going to catch every country, but we have folks here from Sierra Leone, from Lesotho, from Zambia, from Kenya, from Tanzania, from Ethiopia, from India, from Nepal, from Bangladesh and Australia, among many other countries. So thanks everybody. Also seeing people that I know as friends from midwifery associations, from educators around the world, and people that are in regulatory positions. So again, we have the right people here to be listening to this conversation and taking part in the conversation. Next slide, please. Okay, we are going to move into some of our, into our first of our two country presentations. And here it's my very, very great pleasure to introduce Bibi Zahra Masai, who is a midwife from Afghanistan, who I want to say is an emerging leader for JPIGO, represents that solid young to mid-career professional that is going to take the reins and lead us moving forward. Zahra has been instrumental in developing and supporting the Afghan Midwives Association, and recently working on a new Nursing and Midwives Council, a regulatory body in the country. And in that role is currently sitting on their board. So Zahra, I am very pleased to have you here this morning, and I'm going to turn it over to you.
Thank you, Peter, for introduction. Good morning and good afternoon to everyone joining. Today, I want to present you how JPIGO through Himayat project support more resilience midwifery workforce in Afghanistan. Helping mothers and children thrive, Himayat project funded by USAID aims to increase utilization of high quality family planning and maternal newborn health services through introduction and scale-up of culturally appropriate, gender-sensitive, cost-effective, high-impact family planning, maternal newborn health interventions, and is ending this year. Strengthening midwifery was a cross-cutting objective, and interventions included supporting midwives to provide better quality of care, improving quality of midwifery education based on gap assessment, and continue advocacy for regulatory body. Next slide, please. Decades of war and violence have significantly impacted the well-being of Afghans. Afghanistan is challenged with ending preventable maternal and child death, despite concentrated effort to increase number of midwives, increase access to reproductive health services, as well as effort to improve quality of care. For example, only 18% of women receive 4 or more antenatal care contact. Other concern here in Afghanistan always is security situation. Unfortunately, many civilians have been killed, and sadly, healthcare and humanitarian workers are part of these attacks even during the COVID pandemic. Next slide, please. Midwives are a key healthcare provider for sexual reproductive health services in Afghanistan. Educated and regulated midwives have an essential role to play as frontline provider due to geographic and social proximity to community they serve, which is very important in Afghanistan. Investing in midwives helps build a more resilient workforce as part of comprehensive system strengthening. Afghanistan has invested in midwives since 2003, and with donor support, much has been achieved. It is worth to mention that with support of JPIGO, a comprehensive midwifery education system is in place in Afghanistan since 2003. Afghan Midwife Association, AMA, also has established in 2005. Regulation was missing pillar of a strong profession. Working on establishing the regulatory component began in 2009, and JPIGO, along with AMA, Ministry of Health, UNFPA, White Ribbon Alliance, and other organizations advocated for establishment of Afghan Nurses and Midwives Council. Next slide, please. Considering Afghanistan's fragile health system, it was an urgent need to regulate midwifery services provided to women and children, the most vulnerable in community. Public expectations also are increasing day by day for acceptable health and competent, safe and accountable healthcare providers. We found that many midwives are graduating from private school with limited competency. Regulation is a mechanism to raise the status of midwives and ensure they have authority to act on their own professional judgment within their scope of practice. A global study on midwifery by Philby in 2016 shows that gender inequality leads to socio-cultural and economic challenges and weak professional autonomy. And these all experienced by Afghan midwives where conservative cultural norms underpin professional lives. Next slide, please. Overall, establishing a council took 9 years of continued advocacy and activity, and implementation of midwifery services framework was one of the important facilitating factors. MSF is a tool to guide countries through the process of strengthening and developing their midwifery services, and was implemented with support of International Confederation of Midwives. MSF led to prioritization of having regulatory body, and Ministry of Public Health supported and led MSF task force and establishing the Afghanistan Nurses and Midwives Council as a strategic initiative. Next slide, please. As noted previously, professional hierarchy are a barrier to midwives. As part of mentorship project, midwives were paired with doctors to reduce this hierarchy, promote collaborative practice and teamwork, and build capacity in newer skills such as data use. All clinical mentors, regardless of profession, were standardized to provide evidence-based clinical support to high-impact intervention, as well as use of data to inform quality of improvement. Improving quality of maternal and newborn care focused on a mentorship approach to support continued quality improvement, on-site learning of performance, documenting care data collection, and examining it to track progress and identify challenges. Next slide, please. After 2 years of mentorship implementation, there was significant improvement in implementation of high impact intervention on the day of birth across all participating facility. As you can see in the slide, usage of uterotonic for prevention of postpartum hemorrhage and breastfeeding during the first hour after birth, checking mother blood pressure before discharge, and consultation on postpartum family planning before discharge, how much increased. Next slide, please. We were interested to understand more about the midwives' doctor peers, and in a small survey found that both midwives and doctors mostly felt respected, had pride in their role, and felt confident. You can see the result of this survey in the slide. Next slide, please. And now I want to talk about how a great job midwives did fighting against COVID-19. To support WHO 2016 recommendation, an antenatal care Himayat project implemented group-based antenatal care as pilot project in 3 comprehensive health centers in Herat province in 2019 to improve overall quality of antenatal care and experience of care. Both pregnant women and midwives valued this new approach. So when COVID pandemic began with many cases in Herat, quarantine and movement restriction did not stop the midwives. This photo shows the midwives Mojda from Injil Comprehensive Health Center, who was faced with a large number of clients from larger health facility and displaced refugee. The pregnant woman want to continue the meeting, and Mojda modified the approach to provide necessary information and message during COVID-19 crisis. She conducted antenatal care in open area, considering social distance, hand washing, wearing mask, and she educated women on measuring to prevent COVID. Next slide, please. And I think a lot has been achieved. Establishment of Afghanistan Nurses and Midwives Council started a dynamic journey towards improving quality of care. The council will empower midwives to improve health outcomes. The Afghan midwives and nurses demonstrate incredible resilience in the face of many challenges, and this is a fragile, and ensuring safety is an urgent priority. With education, association, and regulation in place now, we need to focus more on leadership to ensure midwives and nurses have a voice in Afghanistan's effort to improve women and children health. Next slide, please. In this year of nurses and midwives, the essential contribution that nurses and midwives make every day in every country is recognized. As you can see in this photo, we supported midwives to raise their voice on the table of decision maker. This photo shows midwives in a high-level advocacy event meeting with the First Lady, UNFPA, and Deputy Minister of Health, discussing on midwifery issue. Thank you very much for your attention.
Zara, thank you for boiling down what's a very complex project into a few short words. And also thank you for leading the team in Afghanistan. Thank you to the midwives and that have built the infrastructure needed to move forward. Has made such a difference. Moving on, we're going to move from Afghanistan to Tanzania. And my pleasure again to introduce my colleague, Benison Babura Uchenguzi. And I'm sorry, Benison, in advance if I did not do well with your name pronunciation. But Benison is also a remarkable emerging leader within our JPIGO team. He has been a technical officer in our More and Better Midwives for Rural Tanzania project, a project funded by the government of Canada. And Benison is a nurse and a midwife, and he has been a clinical and educational leader in his country for over 19 years. So we're very pleased to have Benison providing an overview of our work in Tanzania.
Everybody in the meeting, good morning, good afternoon, good evening. Thanks, Peter, for your introduction. Yeah, the More and Better Midwives for Rural Tanzania is a 5 years project which commenced in 2016 and it will end up in 2021. Based on a workforce development project funded by the government of Canada through the Global Affairs Canada, GAC, and implemented by JPIGO, being a prime partner in partnership with the AmRef Africa, Canadian Association of Midwives, CAM, through Tanzania Midwives Association, TAMA. The project supports the government of Tanzania through the Ministry of Health and the President's Office, Regional Administration and Local Government, pure large, to improve the health and well-being of women and children in Tanzania. For JPIGO, this is the first project to prime under Canadian funds, and for Canada, it is the first project to be primed by an organization that is not based in Canada. Next slide. Next slide, please. And with this project was having the objective to cover by its end, the objectives are being fulfilled through the broad spectrum of activities, which include capacitating building of institutions and the staff, improvement of learning infrastructure by renovating and equipping the skills lab and the preceptor corners where the student midwife get their skills prior to practice to the ready patient, advocate at the national and the district levels on a human resource for health, provision of scholarship to needy students, especially those from rich areas with the failed to pay their school fees for their studies. Next slide, please. With the situation of maternal and newborn health in Tanzania, despite of high coverage of antenatal care attendees and improving facility birth, now it is at 64% according to the demographic health survey of 2016. Maternal and newborn mortality is essentially still stagnant, with the contributing factors which include severe shortage of human resource, especially midwife, who is insufficient to provide care to those pregnant women and their children. Also mixed the quality of this care, and sometimes previously there was a stock out of key drugs, but currently the government is struggling very hard to cover the issue. Next. The aims at reducing the shortage of midwives by increasing more and better midwives in Tanzania. With this shortage, it is difficult to achieve government goals and target for improving maternal and newborn survival through addressing quality of midwives, inadequate numbers, and equitable distribution of human resource for health. So you can check the situation, how it is in a currently. Next slide, please. During implementation of this project, there was some challenges which were faced by the student nurse midwives. There was the issue of this harassment. The verbal harassment was revealed during the baseline where we conducted the baseline assessment, while the sexual harassment was revealed during the midline assessment, which led to revise the code of conduct, which now is in place, and it is owned by the Minister of Health, Community Development, Gender, Elderly and Children, Department of Training. Health and training institutions have regulations to govern harassment issues, including punishing the offender, though before there was no specific policies on harassment, especially on how to deal with the victims of whom have been victimized. Next slide, please. With this project, there were key interventions which have been implemented by the project, especially basing on the quality improvement. The continuous quality improvement are based on quality midwifery education by basing on the safety and the criterion for while teaching midwives at the nursing school in the Lake and Western Zone. This was conducted via support supervision, including clinical drills, mentorship, and using what is called low-dose, high-frequency training approach for basic emergency obstetric and newborn care, that is BEMOC. And mentorship, post-training, also we deal with the gender issues. Next slide. Gender and sexual harassment, sensitization on gender equity and equality to student midwives and the practicing midwife led to more equitable midwifery laws, as well as respect for each other, leading to great confidence and the reduction of the sexual harassment. Also, we provide this scholarship, advocacy, retention, and increase this for lead this volunteerism and recruitment. Also strengthening professional associations like TAMA and increasing new branches and recruiting the members. Next slide, please. With this, improving the midwifery PSC, pre-service education, in order to produce competent midwives in the schools, had to make sure they improve and reach to a desired standard in class as well as in clinical area. Students are now graduating with the midwifery competencies in saving lives of mothers and the children. You can check at the baseline, it was very low, but the target was 85%, both male and female. With the addressing gender issues and the sexual harassment, gender equality, inequality and sexual harassment in the learning environment have been issues that needed to be addressed as they affect the acquisition of desired skills, particularly in female students. These were revealed during the baseline gender analysis and the midline gender analysis, and that it to be diplomatically communicated to the government, who took it seriously issues, revising the code of conduct, student charter, development of anti-sexual harassment posters, which clarify the meaning, examples, actions to follow for the student and staff who witness the victims of sexual harassment, how to prevent sexual harassment to student, nurse midwife, responsibility of the health workers in relation to prevention of sexual harassment to student, nurse midwife, danger, environmental issues, or factors which might lead to sexual harassment and the effects of sexual harassment to student and midwives. These posters has been being produced, as you can see one of the poster there. So the project had to design and train gender-sensitive teaching methodology tutors, practicing midwives. In addition, the project had to initiate and encourage regular dialogue among tutors and students discussing gender and sexual harassment. And we developed a gender desk in schools and sexual harassment awareness integrated in code of conduct to students. Next slide, please. Gender and respective maternity care, strengthening midwifery profession include building capacity of practicing midwife in clinical practicum sites through training on gender and respective maternity care, mentorship and doing follow-ups. Students and practicing midwife are providing gender-sensitive respective maternity care. Interviews with the postnatal women has revealed the positive changes among the midwives providing midwifery care and among students, as well as since they are coached and mentored by competent midwives, as you can see the quotes from that postnatal women. Next slide, please. More and better midwives adaptation in COVID-19 epidemic. During the COVID-19, every activity implemented by the project was stopped while staff were working from home. Meanwhile, communicating remotely with the beneficiaries on taking precautions to reduce the further spread of the disease, at the same time encouraging the nurse midwives keeping on the use of PPE, social distance, and the safety cuffing. Next slide. Yeah, in summary, that close collaboration and engaging government entities and enhance sustainability. Innovative training approaches enabled the project to reach more practicing midwives, and the central government, if it will act promptly, the graduate will be deployed timely to avoid skills decay. And this, the issue of gender transformation approaches if infused greater confidence in a female and male student, as well as practicing midwifery. As you can see there, this is Mariam, one of our beneficiaries, graduated in August 2018 from Kahama Nursing and Midwifery School. She had no job, no place to practice the skill she had learned at school. So she was staying at home while waiting the government to post. It was boring, and the loss of her 2 years training skills because she had always dreamed to become a midwife, one who saves women's lives during and after delivery through use of knowledge and skills. Mariam said it was full of excitement when she was accepted for the internship at Msoma Regional Referral Hospital in Mara Region, Tanzania. For years, she had dreamed working in the government health facility. Upon arrival at the hospital, she was posted to postnatal ward under the supervision of ward in charge, Ms. Prautira Charles Msigwa, who is assistant nurse by title. After months of working and demonstrating her ability and confidence in midwifery, Mariam's supervisors gained confidence in her and requested that the hospital leader include her in the working roster, just like other former employed nurse midwife. And this was a great because it was a very big part of resilience. We would like to appreciate the commitment, determination, and teamwork of all MBM project staff toward reaching the achievement. Appreciate the Japaigo Tanzania leadership and the guidance and technical support from Baltimore for the project implementation. Thanks for your attention. Asante sana.
Benison, thank you so much. Two things that I really want to point out that I noticed. One is thanks for putting such a powerful point on the issues that are and the vulnerabilities that our female colleagues face in the profession, and you know, this evidence really highlights the urgent need to address many of those issues. It should not be unsafe to provide midwifery care. I also want to thank you for the shout out to the students and how student midwives can be appreciated by clients. And I want to say that I see that we have many midwifery students here with us from around the world. And I want to just welcome you and welcome you to the profession. We have a question from, for both Benison and for Zara. Before I get to the questions, I also just want to say that I don't know if you two are monitoring the chat, but incredible amount of positive feedback that are coming in, and thanks for your presentations and for the work that you're doing. I think I'll go to the first question to Zara. And the question for you, Zara, is how do you believe midwives can overcome or address some of the cultural barriers to the provision of reproductive health and sexual and sexual and reproductive health and family planning? You know, again, kind of goes back to the message that Annika gave us, that midwifery has got to be more than about just attending women at birth and during antenatal care. So Zara, what can we do? What are you doing? And if you want to go back on video, that would be great.
Yes, thank you for a question. Sorry, Peter, can you repeat again the question? I couldn't hear first time.
Oh, sure. The question from one of our participants was, how can midwives better address some of the cultural barriers to the provision of sexual and reproductive health care, including family planning?
Okay, so I can see that working for midwives in the very culturally and gender, I mentioned during my presentation a lot of gender-related barrier midwives faced, but midwives are the only healthcare provider in the very remote area, and they provide the services for women, and they have a close relationship with the community, with the with CHW health workers, volunteer health workers, with in the community, and also with the health shura. They work in the community, and in Afghanistan, the context is like a midwife is very close to community, and this social proximity to community they serve help them to be close with the patient and overcome the challenge.
Thanks, Zara. So it's all in what I'm hearing is it's all about the relationship and the knowledge and understanding of the community.
Yes, yes.
Great. Benison, question for you now. And that is, I think, a question that I struggle with over my career, and that is at a very high level, in countries that do not recognize the role of the midwife or where the role of the midwife is confused. What's your recommendations from your work in Tanzania on developing and codifying that role for everybody that can value from midwifery?
Yep, thank you for the very nice question, Peter. Actually, we are very struggling very hard to address the roles of these midwives, and as it was earlier not really varied, but currently the work done has been varied, and also by making these midwives to be competent to deliver what is expected from the clients, then this makes these midwives to be varied. So that's why we are enforcing and mentoring them and making sure that they deliver what is expectations for the clients and the entire community, especially by strengthening these RMCs skills and mentoring to these midwives also makes these midwives to be recognized by the community and the other people who are being saved even at the national level. And they also strengthening these associations, bring them these midwives together, and they share these skills and really new upgrades, and this makes them very more resilient and competent so that they can deliver what is expected.
Thank you both, Benison and Zara. And without further ado, I think we will move into our panel presentation. And what I would like, if I can go next slide, please. What I would like to do now is introduce my friend and colleague, Teresa Shaver. And Teresa is yet another accomplished nurse and midwife with over 35 years of experience in international health, both international health programming and international health technical advancement. Teresa serves as a senior maternal and newborn health advisor in the Office of Maternal and Newborn Health and Nutrition at the USAID, the U.S. Agency for International Development. Sorry, Teresa. Anyhow, Teresa was awarded the Maternal Health Visionary Award by the Maternal Health Task Force at Harvard University in 2018. Again, my pleasure to welcome my friend and colleague, Teresa Shaver, to moderate this presentation. And from this point on, Teresa will be introducing her panelists. So,
thank you, Peter. Thank you very much. Well, good morning, afternoon, and evening to all the participants. And we're up to something like 386 from all over the world. Thank you for joining us. And I have the great honor to be the moderator for our distinguished panelists we have today. This is a topic that is dear to all of our hearts, nursing and midwifery. And today you will hear from 4 amazing global champions, 4 midwives. I'll go through the introductions and through a series of questions. We ask that you send, again, as Peter mentioned earlier, your questions through the Q&A and who you're directing your question to. We'll try to get to as many of your questions as possible, but we will take the questions after I go through a series of questions to each one of the panelists. Let's begin with some brief introductions. First, we have Annette Kennedy. Annette is a board member of the Nursing Now campaign and has a ministerial appointment to St. Clair Advisory Implementation Committee. Previously, she held the position of president of the European Federation of Nurses and was active in lobbying the European Parliament, Commission, and Council. Ms. Kennedy is a registered nurse and midwife, and she is an honorary fellow of the Royal College of Surgeons in Ireland. Annette was the director of a professional development of Irish nurses and midwives organizations for 19 years and established the organization very successful education, resource, and research center. My next panelist is Dr. Jeffrey Smith. Jeff is the Deputy Director of the Maternal and Newborn Child Health at the Bill and Melinda Gates Foundation. He is an obstetrician and gynecologist and a global health strategist of 25 years of clinical and public health experience in developing countries across Asia, Africa, and Latin America. Our next panelist is Pashtun Zaid. Pashtun is a registered nurse midwife with 38 years of experience in midwifery, mainly in management, education, leadership, and mentorship. She's the founder of the Afghan Midwives Association, which was established in Afghanistan in 2005 to give voice to midwives and to regulate midwifery programs. She was elected the first president of the Afghan Midwives Association. She's on the advisory board. She remains on the advisory board of the Afghan Midwives Association. She has a long career of international positions. She had a senior position at the International Confederation of Midwives. She was a technical advisor, and she was a regional midwife advisor for Asia. She's worked for several international organizations and non-government organizations. Our next panelist is Dr. Carleen Wilson-Mitchell. Carleen is very passionate about reproductive justice that informs midwifery education and practice. She practices in global partnerships. She's a current director of midwifery education at the program at the Ryerson University, where she has taught since 2008. Beginning in 1992, Dr. Mitchell's clinical work included the United States, both urban and rural, Canada, Ontario, and Quebec, and midwifery education and leadership building in Global South, Jamaica, Tanzania, Zambia, Burundi, and South Sudan. Her scholarship explores the skills and infrastructure necessary for diversifying the midwifery workforce and strategies to facilitate an equitable and inclusive work environment for midwives and vulnerable populations. With that, let's go into the questions. And I'm going to start with Annette. Annette, welcome. The UNGA leaders have recognized the need for increased investment and a more effective and socially accountable health workforce. With reference to nurses and midwives, as the largest group within the health workforce, what are the opportunities for improving effectiveness, efficiencies, and social accountability? The second part of this question I have for you is, how do we strengthen the system holistically where there may be lots of fragmentation? Annette?
Thank you, Teresa, and thank you for the introduction. Thank you, Japaiga, for inviting me, and good morning, good afternoon, and good evening to everyone around the world. Congratulations to Zara and Binison on a wonderful presentation and great initiatives. I think it's great to hear, and those kind of initiatives should be rolled out everywhere. Let me start first with COVID-19. None of us would have wanted COVID or the pandemic to approach the world. It has changed the whole world. But I think what it has done, and I hope it has done, is that it has made us reflect on how we go forward, or reflect on the healthcare systems we currently deliver, and whether they are appropriate for the health of the nation. I think it has also done is allowed us, we would never have thought that we'd be on webinars, that we wouldn't be traveling the world, that we would be talking about colleges and schools and doing business very differently. and that we would be using IT so successfully, that we'd be using e-health, and we would be using help applications for patients. So I think that we've got a great opportunity for the future. I'm very positive about what will happen after this pandemic. However, let me go back to investment. And of course, we need investment. It's obvious from the fragility of the health system and how it has been portrayed during COVID-19 that we need to invest. We need to invest in midwives and nurses. That's obvious. We're 6 million nurses short, as from the report on the state of the world's nursing that was published in April. I imagine that next year, the Midwifery report will equally show similar picture. But what worries me more than anything, and worries ICN, is the current state of the current cohort of nurses and midwives we have in the system. We did a report just last week on 40 countries, which was related to the problems for them with COVID-19. And over 1,000 nurses in the 40 countries have died. There's 195 countries worldwide. So you can imagine what that might look like. We know that 10% of all healthcare workers have been infected. The WHO say 14%. We're talking about over 3 million. We can't afford to lose those people out of the health service. So what I'm saying is, before we can do anything, before we can talk about education, about going forward, about collaboration, we have to look after our current cohort of midwives and nurses, and we have to support them. And WHO brought out a charter on Wednesday, and we would be asking, demanding all governments to implement that charter. Now to look at education and how we do things differently. I think that what we have to do is, and it's up to, I believe, the nurses and midwives who have a great affinity to public health, to primary care, to health promotion, disease prevention. And I know that midwives have been very successful. I know they have pushed very hard for keeping mothers and babies out of hospitals and out of, I suppose, medicalized care. And if you look at what has happened during COVID-19, the most successful countries, and I'd say led by women, because I'm going to put that bit in, have taken a different approach. Their approach has been about community, about talking to the community, about testing, about tracing, about prevention, whereas other countries have gone to getting enough beds, getting enough ventilators, making sure we have in medicine that we're prepared there rather than in prevention. So I think we can learn from that, and it's up to us to think about what is the best model of care for the future. What is the best model for nurses and midwives to deliver before we ever get to collaboration on education and on regulation or whatever that may be. That is so most important. Besides, there is another aspect to that, and I think, and listening to the two speakers from Afghanistan and from Tanzania, it's very important that we look at what is suitable for the different countries. What is suitable for one country may not be suitable for another. And I think we have to listen to the people in country. We tend to impose a Western society. We tend to impose Western medicine. Not correct. They have a lot to offer us. Are you trying to tell me I have enough said?
No, keep that fire, Annette. We're coming back to you, okay?
Yeah.
I really appreciate that, and I also appreciate you bringing forward the women who have lost their lives during this pandemic. And what do we do for both honoring them and then also to make sure that there is, some kind of cohort that can help support and to we continue the education process to have more. Jeff, this goes on to you. I know personally you are a huge champion of midwives, and I've witnessed that over the years. Many countries, including Afghanistan and Tanzania, are challenged with the high stagnation of maternal and infant in child mortality. Why is midwifery profession a good investment in ending preventable maternal newborn deaths? Jeff?
Yeah, thank you, Teresa. And I just also want to thank all of the other panelists and all those who have joined this webinar, not only for your interest, but also for your dedication to women. It is during this time of COVID that we need the strong and dedicated health workers such as yourselves to be on the front line to continue to provide excellent clinical service. I want to thank the panelists and everybody on the webinar for their dedication, because it's really establishing the confidence in the health system and the reaching out to women during this time of COVID. That's incredibly important. But thinking more deeply about the challenge that are facing countries regarding high maternal and newborn mortality, really, midwifery is one of the most effective interventions, and it's one of the best buys. We know from the State of the World Midwifery Report that 87% of the essential services needed for maternal, newborn, and reproductive health services can be provided by midwives. So they are an effective and efficient element within the health system for ensuring high quality care. I think also the investment in midwives really is an incredible rate of return for that investment. There's a 16-fold return on investing in midwives in terms of efficient use of health resources and reduction of cesarean section services. As an obstetrician, I recognize cesareans are not always the best approach for ensuring good maternal and newborn care. So identifying strong and high quality health services are often the best way to ensure that women are provided with respectful and high quality care. So making sure that we invest in midwives in the services that empower midwives to make effective decisions and ensure that they have the best outreach to women is one of the interventions that is known to strengthen both the primary health care system and help us achieve universal health coverage. So I'll pause there, and hopefully the quality of the sound is improving.
Thank you, Jeff. And I really appreciate you and all the work that you've done over the years, and especially bringing up about the respect, not only for the midwives, but respectful maternity care as a theme throughout. I'm going to go on to Pashtun. Pashtun, you know, I hold dear the time that you met me in Afghanistan in Kabul, and we went through the hospitals and you introduced me to the Midwives Association. You've heard from our presenters, especially in Afghanistan, that the professional hierarchy, you know, we've seen that. That is really a stumbling block in many settings. How does this affect the accessibility and quality of women-centered care? And midwives often experience the lack of respect. What are your suggestions for improving interprofessional collaboration, practice, and building partnerships, especially between, we just heard from Jeff, between obstetricians, pediatricians, anesthesiologists, and midwives? Pashtun?
Thank you very much, Teresa, for introduction and for the question. First of all, good morning, good afternoon, and good evening to all, wherever you are. And I really, I'm very happy to listen to Leslie and to Anika, wonderful speeches. I'm sure their speeches give a lot of hope and inspiration to the midwives. Thank you to all the presenters, and as well as to Leslie and to Anika. Jeff is a champion. In Afghanistan, wherever you go, even in a very small village, they know Jeff. as a champion for maternal and newborn health and midwives. They love Jeff a lot. So thank you, all of you. Regarding this partnership between midwives and mainly OB/GYN and other healthcare professionals and maternity, it's vital because they are member of the same team. And a culture of interprofessional collaboration and cooperation between midwives and other maternity care professionals is beneficial to the healthcare of mother and children, minimizing duplication of tasks and maximizing job satisfaction. My suggestion and recommendation to the midwives are your knowledge, your skills, your compassionate midwifery model of care is your power. So please invest in it at both personal level and professional level. Make sure you're at the policy and decision-making position. So make a space for yourself. Get involved, even if you're not asked to do. This is my experience. So please try to make space for yourself and be involved with the policy and decision making, and as well as some discussion related to midwifery. Make a space for yourself. Don't wait for invitation. And my special recommendation and request to the midwifery leaders, please make sure that in any point, any time, you don't have a shortage of midwifery leaders. Most of the time, countries, they think about the number of the midwives they need, but no one think this number of midwives they need. Leaders, they need tutors, they need managers, they need preceptors. So this is the leader of midwifery to think about and advocate for it. Please invest on young midwifery leaders and potential leaders. It is so vital to address all these challenges and issues. A strengthening of professional bodies. It is so important and very important to strengthen the professional bodies, because professional bodies provide a platform to collaborate and coordinate. Based on my experience with the Afghanistan Society of Obstetrician and Gynecologists and the Afghan Midwives Association, so a true partnership can be possible if there is, when you make sure that you make a strong efforts, not just one time, a continued efforts. I'm sure it will work and establish a great partnership and collaboration between both professionals.
Pashtun, thank you. And I think it's really key that effort and that interprofessional relationship is so important. We need each other, and we have the best outcome and impact when we work well together. Thank you for that. And I thank you also for putting the plea out for midwives not to be afraid to take leadership roles, to move forward, to be in leadership positions. And through the years, myself, I've seen so many that are reaching those positions, and both professionally in organizations, UN organizations, and in government. And that's what we've got to keep doing. We are making progress, slowly but surely.
Yeah.
Thank you very much. My next question is to Carleen. Carlene, you're planning to share with us, as we often ask in situations, tell us the how-to, and you're going to be sharing that on some slides with us around quality, equity, and dignity as core principles of sexual and reproductive health care. You're going to give us a country example. We know these are very complex and sensitive issues. How can we be ensured midwives have the skills, the support, and the behaviors for success? Carlene?
That's an excellent question, Teresa. Thank you so much. I'm going to dovetail a little bit on what everyone has said so far, and I really thank Annette, Zara, Benison, and particularly the folks at Jhpiego for just all of the work that they're doing to promote respectful maternity care. So you're asking, how can we ensure that compassion and all of those soft skills are taught? Because many of the midwives worldwide are taught the clinical skills, the hard skills, but it's much harder to change values, behaviors. So how did we start? How did we manage this? First of all, we modeled what it was to be involved in a respectful partnership, respectful relationships, and knowledge sharing, creativity, inclusiveness, in the hopes that our Tanzanian midwifery colleagues that we were working with would be able to emulate that and be able to imitate that, and also begin to model it themselves. As we trained them, they were going to be training and being champions at their own facilities when they left the workshops that we did in 6 different areas in the western and lake zones of Tanzania. So we were teaching respectful maternity care by example as we facilitated the workshops and as we asked them to even participate in the facilitation. We even chose class leaders who, within a particular workshop helped with decision making and coming to a consensus about what we should do about things as simple as what time we should have a break or a lunch, or how we should design a community-based project. There was a secretary, there was a motivator assigned to each workshop who cheered everyone along with songs, dancing, jokes. So we had the participants actually practice respectful advocacy for each other and explored community-based solutions for respect, disrespect, and abuse that they were witnessing and observing in their own facilities. And you've already heard very well from Benison that disrespect in terms of interactions with colleagues and disrespect in terms of interactions with their patients, their clients, and families. The scenarios that we role played were made real by the midwives' own stories and experiences in their facilities. We addressed their vicarious trauma after having witnessed disrespect and abuse, but that feeling of helplessness that they expressed to us. Our methods of validation, non-judgmental support were all to be adopted when they returned to support their own colleagues. We co-designed and delivered the workshops together. We leveraged our own privilege and access to publications and opportunities so that this allowed us to co-create an article with the other members of the team that were developing these workshops in the Reproductive Health Open Access Journal. So from beginning to end, throughout the development and the delivery of our workshops, we were trying to model what we were hoping they would do in their facilities, which is to treat each other with respect. Does that answer your question?
Yes, Carlene, very well. Thank you. And I really appreciate the approach and the modeling, and it's fantastic. I'm sure people are going to ask for more information following this webinar. Thank you. Annette, I'm going to go back to you for the second question. As we've heard from many of the panelists already, nurses and midwives are predominantly a female profession. They share struggles and often linked to gender inequity. One manifestation of the gender nature of this profession is a lack of voice. And we heard that earlier also. Not being at the table, having leadership. There was a key finding, this was a key finding in the State of the World nursing report that just came out, And I anticipate that it's going to come out very strongly in the State of the World Midwifery Report in 2021. So this is not, we all know this. How can the nursing and midwifery profession best work together to build leadership, stewardship, and management capacity? Annette?
Thank you, Teresa. And yes, you are correct. It did come out very strongly in the State of the World's Nursing Report, and I have no doubt it will come out in the Midwifery Report as well. I'm taken by Judge Ginsburg's comment, and which was, wherever there's a decision to be made, there should be a woman. And I was going to turn that around and say, wherever there's a decision to be made, there should be a nurse and a midwife. But then as we cross all healthcare, and healthcare crosses all aspects of life, I still go back to where the decision to be made, everywhere there should be a woman, that's for sure. And I agree with all what the panelists have said, you know, because I'm going to try and build on that. I think sometimes we're our own worst enemies. I think sometimes that we tend to talk to ourselves. Well, we know what we want. We know we can praise ourselves on the back and we can clap ourselves, but that's not talking to society at large. It's not talking to the interprofessional colleagues. So I think we have to get out of that mode. And we have to decide too that we all agree on a goal, because sometimes I don't think we do. And I'm thinking about, you know, the regulatory bodies, the associations and the unions and all the educators and all the other bodies. And you'll have the regulatory bodies saying, we're protecting the patient. You'll have the associations and the educators saying, we're building on professionalism and education and research. And you'll have the unions saying, well, we're trying to support the nurses and get better conditions of employment for them. All true. And I believe that is all necessary. But we're not different. The goal is the same. The goal is that we have better patient care, better people care, better care for women, children, the dying, the men, everywhere. We have that is our ultimate goal. And in order to get there, we have to have the most competent and the most educated, skilled professionals who are well looked after, who are treated with respect, who have the best conditions of employment, and who have pay that is commensurate with what they do. That's what we have to do. And as stated by in the Patient Safety Day, you know, having nurses and midwives safe is two sides of the same coin. If they're safe, if they're well protected and well looked after, you will have patient safety. It goes without, happy nurses, happy midwives make happy patients. That it's as simple as that. So that's for one thing. What we should do, I think that we have to get out of our cocoons and talk outside ourselves. And even if you're talking about students and curriculum and all of that, I'm not sure we put enough emphasis on talking to our students about, you know, who are the important people in hospital or in healthcare? Well, they're usually finance or they're usually the CEO. They may not be the director of nursing. That doesn't say the director of nursing doesn't have an important aspect. Or it may be politicians. Why can't we bring them to government and show what happens? Why can't we encourage them to get involved in community societies? That's something that I did. I wasn't a great teacher, I must say, because teaching wasn't my forte, but I did bring them to government. I did bring them to meet the finance controller and people like that. Why I did it, I'm not sure. I just felt it was important that you should know who makes the decisions. And that's as important as any curriculum we teach. We also should allow them to be open to have ideas, because they're the ones that have great ideas. They can change things. We're gone past that. We have ideas that sometimes are not the greatest ideas, but the youth coming on, they're the ones that have the greatest ideas, and we should listen to them. So for me, it's all about, you know, how we do business, changing the narrative, changing our own narrative. It has to be like that. And one last comment, which is very important.
Go ahead.
We talk about women in the home, and we talk about, you know, them bringing up children and rearing and older people, and we give them no money. We don't pay them or anything else like that. And yet, that is the most important job because they're developing the leaders and the decision makers of the future. So until we change that narrative, it doesn't help women in society.
So very true and so very powerful. Thank you.
Teresa, I came back on just to say that I wish we had scheduled 2 hours. I feel like I'm always saying that, but we made the decision with the engaged audience. We will extend for another 15 minutes just to remind people if you have to leave, this is being, no apologies. If you do have to leave, this is being recorded and we will make sure that the recording is well available to everybody. So Teresa, back to you for another 15 minutes, reminding you we have a closing as well.
Okay, all right, so let me move on very quickly because we do want, and there's a lot of questions for the panelists too. So Pashtun, many midwives working in humanitarian and especially as we know in Afghanistan, in fragile settings, are experiencing safety and security challenges as well as various effects of gender inequalities. All countries are faced with an ongoing global pandemic that we are trying to grapple with. So building the resilience and capacity of a midwifery workforce is key. You've been an architect of this in capacity building in various settings. What are your recommendations on how to best achieve results and protecting and supporting midwives and building a resilience within the profession to better cope with the shocks in the health system that we're experiencing at this time? Pashtun? Pashtun, you're muted. You're muted.
Yeah, thank you, Teresa. Just I said that I want to answer this question about the sad story of midwife Mariam. She was working in Dashbachi Maternity Hospital in Kabul, which was attacked a few months back during Ramadan by one of the terrorist group. The time the attack started in the hospital and the other staff, they went to the safe room. But Mariam, according to one of the colleagues of Mariam, they asked Mariam to go to safe room and she refused to go and said, no, I can't leave a mother who was in the second stage of labor. Mariam said, no, I can't leave the mother. And the end, Mariam lost her life. And so that I know many midwives inside Afghanistan, even outside of Afghanistan, maybe they face such as security and safety problems and challenges. Being an Afghan, I'm witnessed the best and the worst of our times. And now with the COVID-19 also is teaching us the hard lessons. As I'm representing midwives, and I'm mainly talking to the midwives, and I'm recommending to everyone, to all governments, to all the people, the first thing to remember is to remember that this is a midwife who provides continuum of care. You find midwife in the hospital, health facilities, as well as at a household. We want the midwives to provide the quality, respectful care everywhere, wherever she works. A midwife also intends to have an enabling, safe, secure environment to work. We ask midwives to go and work in the very remote area of the countries without necessities of living, like schooling for her children, without running water, security and safety measures. So how a midwife can do that? So I'm requesting to the countries, please invest in human resource management. My plea to the policymakers, not just to think about the numbers, it is important. as well as about the quality of healthcare professionals. We need to make sure when you invest in midwifery workforce, make sure that your midwives is ready to work, prepared, well equipped, well educated, well resourced, well empowered to work in the very remote areas and the community level, because a health system needs to be ready if the hospitals or health facilities are not approachable or not functional, but the health system needs to address the need of the community. For example, during COVID-19, many mothers, they delivered at home without presence of any healthcare professionals. Or maybe some midwives, they went to help the mothers, but without having a supporting system. So this community-based health system needs to be linked to the bigger health system. And the last but not the least request and recommendation to the countries is to please invest in midwifery, all three pillars of midwifery profession. It applies to any profession, but I'm talking about midwifery profession, which is education, regulation, and professional association. Because if any of the pillars is weak, the entire profession will be weak.
Thank you, Pashtun. And there's been comments, and I think we're all heard the story of Miriam and how horrible that was, how horrific that was. And you know, I think the theme very much is to really to learn across. And so true. We've got to especially support, the health system has got to support midwives in these fragile and insecure settings. But Jeff, let me move on to you. This is the year of the nurse midwife, and our colleagues at the World Health Organization are now referring to this as a decade for nursing and midwifery. Woohoo! Please share your vision for midwives and at this decade and going up to the SDGs at 2030. What should be prioritized and why? Jeff?
Sure. I think it's really fantastic that WHO is recognizing not only the year of the midwife, but extending it to the decade of the midwife and the nurse. I think getting to the SDGs in the year 2030, we have to become much more creative. We no longer can do business as usual. We've got to invest in the midwifery workforce, and as Pashtun and others have said, we've got to address issues of the health workforce, health leadership, good management, and really understanding that in order to achieve the SDGs, we have to establish a strong base of good quality midwifery care, and that requires competent midwives. But then those midwives need to work in collaboration with other members of the community, and other professionals as part of a team, and looking at issues about networks of care and issues related to expanding the respectful and quality care really are essential for ensuring that midwives are at the center of any solution that is moving us forward for the next decade. Here at the Bill and Melinda Gates Foundation, we really are looking at the evidence and the research that's necessary to gain the critical information that will take us from here to the SDGs in 2030. And that's why we've been joined with many of you in establishing new investments that really look at a stronger base for both midwifery services and health services in general.
Thank you, Jeff. And I'm going to go on to Carlene now. Carlene, you gave the example of Tanzania. We've heard our Tanzania presenter earlier in the webinar. So can you share, how does working through professional associations contribute to building more sustainable health systems and resilient health workforce? Carlene?
A great question. How can we be successful basically strengthening midwifery? Because the health force is very closely related to the professional association that provides them with support, ideas for future education, and partnership and solidarity. And so based on the experiences of the Canadian Association of Midwives twinning with the Tanzanian Midwifery Association, we considered ourselves equal partners. It wasn't big sister helping little sister. Tama led in the priority making and setting and the appropriateness of the content that we developed. They did the hiring of the midwifery project leader, and he's actually on our seminar today here, Stefano Simba. The midwifery educators and the equity researcher and educator were all very integral part of the teams. And so we provided the context, the culture, and the appropriate learning and teaching methods coming from the Tanzanian perspective. And it helped us to facilitate much more engaging workshops. So for instance, we spoke a lot, and this has been coming out in the Q&A quite a bit, on how do we strengthen and improve some of the skills, both the leadership skills, the clinical skills, and how do we engage the midwives who've sometimes been excluded from educational opportunities. We did have some midwives who were not really strong in their English language skills, but we were still able to engage them, help them to strengthen some of those language skills, and actually help them to take up leadership roles even within the workshops. So, you know, we use song, storytelling, traditional Tanzanian cultural methods to deliver that engaging workshop. From, you know, looking at observations 3, 6 months, maybe a year later, how do we know whether what we did worked and whether it's sustainable? Well, we'd have to look at how well they were able to build relationships back in their facilities with their administrators, their chief medical officers, and be able to continue to implement some of the changes to infrastructure that could allow them to sustain respectful maternity care, because it was not only their values and knowledge, but it was also the resources, infrastructure, partnerships in the community that would help them be able to sustain this. And so individually and collectively, we observed that our interactions and some of the projects that they actually, you know, had a plan, do, act, kind of a plan for, helped them to together build solidarity, camaraderie, collegiality, and empowerment. And we noted that this was vital for their mental health, for their self-esteem. Some of them had been involved in untenable situations where they had a lack of equipment, medications, human resources. So in order to teach them respectful maternity care, we had to teach them to be social innovators, to be creative. And that is not something that is often taught in a basic program, but we're realizing it's essential for leadership. They will continue to be groomed by the Tanzanian Midwifery Association, and that mentorship will continue. What we were able to achieve, from what I understand from the feedback we got from the Ministry of Health, was one of the very important policies that they had been trying to implement, the National Client Service Charter, which really enshrines the human rights of the patient in institutions and facilities, and really is, you know, has the 7 tenets of respectful maternity care. We were able to accomplish what they weren't able to do before, operationalize it so that it could become an addendum to the curriculum of the midwifery education. So never underestimate what a workshop can do. And we're going to continue, hopefully, to hear great reports from Tanzania about how they're having, you know, lunchtime or during their break, how they're continuing the idea of teaching each other and learning with, from, and about each other as they implement new ideas for, you know, galvanizing resources, connecting with community leaders, and so on.
Thank you, Carlene, and thank you for that example and also the twinning. We're really running short of time. I'm sorry, everyone, but let me start with a few questions because they have been just bubbling. Jeff, starting with you. Midwifery research has been really lagging. What's your thoughts on how to kickstart that and make it fast-tracked?
Thanks, Teresa. I think we need to not only focus on the content, so looking at new innovations and new approaches to how midwives provide care, but we need to build the competency of midwife researchers. I think we need to have a dedicated effort to build young leaders with with both research skills and leadership skills so that they can take not only they can do the research themselves, but then they can really advance the profession and advance their colleagues by speaking out and presenting that information. So content and process.
Thank you. Thanks. Let me look here. Okay, here's one. COVID times, how best to introduce midwifery education as role modeling is so important. Yeah, as we know, universities, schools are all closed down. Thoughts? Carlene, I'll pass it to you.
I think one of the things that we're going to be learning how to do is using our smartphones, using our tablets, and even using a regular telephone that isn't a smartphone for communication. One of the things that COVID has done for us is it's asked us to be more creative in the way we communicate and deliver information. E-health, telehealth, and partnering with organizations that can help us build more strength in our systems. If it means a satellite, if it means improving the Wi-Fi in an area, if it means using technology and partnering with biomedical folks and engineering folks and IT folks so that we can in fact deliver information in a new way.
Thank you, Carlene. Pashtun, this is a question to you. How can we best advocate for midwives in countries where they don't exist?
I think as Jeff mentioned, this decade of midwifery nursing is providing lots of opportunities, and country, regional, and global platforms we can advocate, not just the country level, definitely the professional bodies, and as well as the regional and the international level, all the maternal newborn health and health community. We need to put efforts together and advocate for it. Yeah, it is a global effort should be there to yeah, I know it will work.
Thank you, Pashtun. Annette, this is a great question also. As we know, nurses and midwives are paid peanuts. So how do we address this, and especially in a critical time such as COVID-19 that we're all facing in this pandemic?
Yes, I agree, we're paid peanuts because if you remove nurses or midwives from the service, you don't have a service. I think it's a great opportunity for us. We've got the profile now, but it's really up to us to look for the salary and conditions that we are worth, and we are worth a hell of a lot. And I think that one of the things that we don't do a lot at all, we save lives. I was just listening to a program on my own radio in Ireland this morning, and they were talking about intensive care nurses, and they were talking about they cannot open another bed without 5 to 6 intensive care nurses. Well, they need specialty training and all of that. Well, if they're that important, then surely they need payment. So I think it's up to us to seek what we are well entitled to as nurses and midwives. And just to say, I was looking at reading a book on Ireland in 150 years ago, and there was 1 in 7 babies died, 1 in 3 or 1 in 4 maternal deaths. And now in 2019, no maternal death, and no about 2 to 3 per 1,000 of babies died. But like that is all due to midwives. It is all due to the competence and skills. Well, if we think that's valuable, then we have to put the investment into that. But I don't think we should take things lightly. We have to fight for it.
Yeah. And with that, our discussion could go on and on and on, and I would love to be with you all personally. I just want to thank you all personally, and what an amazing group. We will keep up the fight. It's not over. And I know all of us on this on the panel and myself, we haven't given up. And it's that next generation of midwives that we have to continue to promote and have be leaders. And I know that all of you are committed to that. I'm going to turn this over now to Peter. Thank you all very much, and thank you to the participants.
Well, I will just echo the wise words of Teresa, and not much left to say here. I know we're over time, except to say thank you. And I think 2 points that I've picked up on that I think are themes from today. One is there is clearly a very, very strong vision and a clear vision on where midwifery needs to go in the next 10 years and how to get there. But there's clearly also lots of work to be done. And I think what I've seen from monitoring the conversation that's occurring by the participants, lots of enthusiasm for getting that work done and a lot of expertise out there. We all anticipate the upcoming State of the World Midwifery Report in 2021, and I am confident that that report is going to provide clear findings and recommendations that will expand on that vision that's been articulated well today. And I want to thank everybody again for being here. Few people that I want to thank, in addition to our panelists, in addition to our presenters, our keynote and introductory notes. I want to thank our communications team and Indrani and the communications team for all the hard work that they've done. We wouldn't have been able to be here without their behind the scenes effort. And I particularly want to send appreciation and acknowledge the work of our orchestra conductor for today. And that's Sheena Curry, who's a senior technical advisor who has provided direct support to numerous countries, but in particular, the Afghanistan teams and the Tanzania teams. And Sheena, you weren't on here, but you were behind the scenes today and with us, leading us for the last several weeks. And just want to say thank you, thank you, thank you. So lots of work to be done, and good luck in the future.
Bye-bye, everyone.
Bye.